name is Filipa Alves da Costa, and I am an assistant professor with habilitation at the Faculty of Pharmacy, University of Lisbon in Portugal. I've been acting in FIP for some years, and currently I'm the Vice President of the Social and Administrative Pharmacy section. In this episode, we will provide you with an overview of behavioral economics and how this links to healthcare. So I'll start by saying that I have no conflicts of interest to declare. The learning objectives of this video are that by the end of it, you will be able to understand the definition of behavioral economics, describe how it may be used to positively influence health-seeking behaviors, and list some examples of behavioral economic interventions applied to public health and also to pharmacy practice. So let's start by defining the concept. Behavioral economics is a field that combines insights from psychology and from economics. And this will help us understand how individuals make their decisions, which often diverge from the rational actor model traditionally assumed in economic theory. It explores how cognitive biases, emotions, social influences, and heuristics impact on people's choices, revealing that decisions are frequently irrational and also influenced by context. So there are some key concepts in behavioral economics, and these include, for example, loss aversion, which means that people fear losses more than they value the gains. And also availability heuristics, where individuals overestimate the likelihood of events based on their most immediate recall. I will detail these two concepts, a few more that are really relevant in this area. So the ultimate goal of behavioral economics is to design better policies, interventions, and products that will align with actual human behavior. And this will improve decision-making and outcomes in various domains. So let's first look at these relevant concepts I've mentioned. So here on the slide, you can see 6 of them. There are more, but these are the most relevant. So as I mentioned, availability heuristic is one of them. And this refers to the fact that people easily rely on information they recall, and this happens much more than in the actual data that they may have access to. So, for example, when you go to the beach or to the forest, you may feel terrified that you get attacked by a shark or by a bear. And this happens even more if you've recently seen a film or read a book where these events have occurred. However, if you look at the data, you can understand easily that these fears are irrational, as these incidents actually occur very rarely. The second concept is bounded rationality, which refers to the fact that people have limited cognitive ability, information, and time, and do not always make the correct choice from an economics point of view, even when information is available that would point them towards a particular course of action. This might be because they cannot synthesize new information, at least quickly enough, because they ignore it, and they instead sometimes choose to go with their gut feeling, or even because they don't have the time to fully research all the options that are available. Bounded willpower captures the idea that even an understanding of the optimal choice, people will often still preferentially choose whatever brings them the most short-term benefit over incremental progress towards a long-term goal. For example, if we know that exercising may help us obtain our fitness goals, we may put it off indefinitely, and we will keep saying, I will start tomorrow. The same rationale applies to smoking cessation, particularly when you're in a pre-contemplation phase. Then loss aversion, a concept I've referred, which refers to the fact that people are more averse to losses than they are to make gains. And an example of this is that it might be more painful to lose £100 in the street in relative terms than the happiness that it may bring to you to find these same £100 in the street. The Sunk cost fallacy is the idea that people will continue to invest in a losing project simply because they are already heavily invested. And even if this means risking more losses. This is the typical behavior, for example, that gamblers exhibit when they lose, but they keep desperately gambling, hoping that their luck will change. Finally, mental accounting is the idea that people think about money differently depending on the circumstances. For example, if the price of gas goes down, they may begin to buy premium gas, and this will lead them to ultimately spend the same amount rather than taking advantage of the savings offered by the lower price. So, how can we apply these concepts to healthcare? One of them is by helping us to understand how patients, providers, and policymakers make decisions. And this happens often in ways that deviate from the traditional economic models. So, by understanding the cognitive biases and heuristics, behavioral economics helps us design interventions that promote healthier behaviors and improve health outcomes. So, this can inform the design, for example, of insurance plans, but also of public health campaigns by highlighting the importance of clear communication and of framing of effects. Overall, it aids in developing strategies that align with real human behavior, making healthcare more effective, efficient, and patient centered. So I'll give you a few examples. And I would start with one typically from the public health area, which is how we can use this science to reduce obesity through improved dietary choices. So the traditional approach is to design educational campaigns that will inform people about good and bad choices. However, we know today that this has very limited impact, as this technique will rely on individuals making rational choices based on information alone. And if alternatively we use a behavioral economics intervention, we can resort to other techniques. For example, by nudging, we can use default options, and this will apply, for example, redesigning the school cafeteria menus so that the healthier food options are the default choice. And this will make students able to more likely consume healthier foods without actively choosing them. And in the long term, this will lead them to have improved dietary habits. Another approach is through salience and framing, which would consist of presenting caloric information and health benefits of food choices in a vivid and easy to understand manner. So normally we use images that are that capture the individual's attention, and this has been used for long in the public health arena. The first one was by using it to the tobacco industry. So this is typically the technique of loss aversion, which will consist of having terrible images being displayed. For example, you see dark lungs, you see strokes, or even people dying. But this recently has also been adapted to food and to alcohol by improving the labeling used in all of these. A third option would be to use incentives and rewards, whereby implementing a reward system, individuals can earn points for choosing healthier foods. And these can be redeemed by other non-food related items. So the outcomes will, of course, be that higher rates of healthy food selections will happen as individuals will seek to maximize their rewards. And this is a technique that has also been used in pharmacy practice, particularly in the field of medication adherence. Another option would be to use social influence. And here on the slide, you can see Ronaldo. Probably you all have heard of Ronaldo, a famous football player in Portugal, whereby using testimonials and endorsements from these social influences, you encourage healthier eating habits. So in here, you see Ronaldo drinking water rather than choosing an alcoholic beverage or even Coke or any other soda that contains a lot of sugar. So finally, another technique is to resort to commitment mechanisms, which provides us tools for individuals to set and track their own health goals. And this can have reminders and incentives for maintaining those commitments. So here on the slide, you see, for example, this is being done with physical activity, but it can also be done with food. So in the example, you see an alert that's being displayed that says, congratulations, you have achieved your daily 10,000 steps. Now, let's look at the same techniques but applied to pharmacy practice and some key actions that may be taken. So the first is about understanding patients' behaviors, and this will be made by recognizing common cognitive biases, such as present bias, which favors immediate rewards over future benefits, and also status quo bias, which means preference for the current state. And both of these will help pharmacists understand why patients might not adhere to medication regimes or to any lifestyle recommendations. And this will then provide insights that can enable pharmacists to tailor their communications and also their interventions to better support medication adherence. The second point is about improving medication adherence through small changes in the way that choices are presented. So, for instance, through nudging, we can set up a default action which will set up automatic refills, and this can make it easier for patients to be persistent with their medication regime and prevent discontinuation. We can also improve medication adherence through rewards or incentives for those who consistently follow their regimes, and this may be made in the form of discounts or loyalty points. Thirdly, the way that information is presented can influence patient decisions. So we can use positive framing, which means emphasizing the benefits of taking medication, rather than negative framing, which is highlighting the risks of not taking medication. And this has been proven to be more effective in encouraging medication adherence. However, as I've mentioned before, not all people are the same. So in some patients, it may be more useful to use loss aversion as a prevention strategy. And this may be achieved by highlighting the potential losses from not taking these preventive behavior. Then you can also use example from peers, and here on the slide you see a small video which I will start playing as I keep talking, which shows a pharmacy leader who is well recognized perhaps by many of you, who can encourage people to try and be like her and engage frequently in physical activity. And finally, you can arrange the pharmacy layout to guide patients towards healthier choices by placing frequently used medications or health products in easily accessible locations, or even by creating an easily accessible entry to the room where you provide the advanced services. So to finalize, I'll just leave you with a few takeaway messages. First, behavioral economics combines insights from psychology and economics to understand decision making. Secondly, merely by having information, this does not dictate how people behave. So their decisions will depend on environmental factors, which of course include peer influence, and these you can enhance through behavioral economic techniques. People value gains and losses differently, and therefore understanding each person's health belief model will be important to decide if, for instance, you can use positive framing or if it's better to use loss aversion. Nudging and other tools can also support behavior change. And finally, behavior economics will help us designing better policies, tailor our public health initiatives, and improve business strategies applied to the promotion of advanced pharmacy practice services. I would finalize by thanking you for your time to listen to this video. And now let's use the knowledge gained to improve our pharmacy interventions. Thank you.